September is now Ovarian Cancer Awareness Month in the state of Missouri, opening more doors for education, funding, and research.
Yeah, the disease affects hundreds of women in the St. Louis area every year. 5 on Your Side's Laura Barcheski sits down with a survivor and doctor behind the movement to educate. Laura?
Mike and Kelly, around 80% of ovarian cancer cases are diagnosed in advanced stages, making this designation for September a huge milestone for those fighting it.
So I was originally diagnosed in summer of 2016. Up to that point, I'd had 57 years of perfect health, no issues at all. But I started to experience some postmenopausal spotting, very light, but enough, like there's no good reason for that, really.
Joan Gummels consulted with her doctor for months, ruling out other cancers and illnesses before an ultrasound revealed a growth on one of her ovaries.
I chose to see a specialist, a gynecologic oncologist, and I really think that has made a huge difference in my story. I had a complete hysterectomy, during which they did a biopsy of the tumor and confirmed that it was ovarian cancer.
After surgery, she went through chemotherapy and went into remission for 4 years until she got the worst news: the cancer came back.
So since that time, I've really been in chemotherapy part of every year.
That's when she decided to get involved with St. Louis Ovarian Cancer Awareness, also known as SLOCA.
I just began to get involved actually in the Survivors Teaching Students program, where survivors will go and we will speak to classes of future medical professionals. Make them aware of how we were diagnosed and what our treatments have been like.
She's now the president of the SLOCA board that advocated at the state capitol to make September Ovarian Cancer Awareness Month in Missouri.
One of the reasons we really wanted to get a state law passed was to have a platform to get beyond the city borders, the county borders, in the metropolitan area. There are many people who travel to get treatment who live in rural areas.
That treatment and diagnosis requires a specialist like Dr. Shannon Graybosch. She's a gynecological oncologist at St. Louis University Hospital.
So, for example, for breast cancer, we have mammograms. For cervical cancer, we have pap smears. There is not a screening test for ovarian cancer.
Making it even more important to know the signs.
When you're eating, if you feel full earlier than you did, or if you have a change in your bowel or bladder function, sometimes spotting after menopause or postmenopausal bleeding can be a warning sign. Feeling bloated or just generally more uncomfortable in your abdomen or persistent pelvic pain. And the tricky thing is, I think all of us feel those symptoms, right?
Dr. Graybosch says there are some preventative measures you can take, especially if your family has a history of cancer.
A patient could potentially get genetic testing, identify that they have a mutation, and undergo a risk-reducing surgery before that cancer develops, which is life-saving.
Joan says she's glad she listened to her body to have the opportunity to get treatments that keep her going.
I recurred in late 2020 and it's never gone away. So I just live with metastatic ovarian cancer.
And now she wants others to listen. It might save a life.
But when you listen to your friends or family members and you hear something like that, bring it up to them, keep ovarian cancer on the radar screen, and encourage them to get treatment. Because if people do that, it will make a difference to someone.
SLOCA has a few events coming up, including a 5K, and you can learn more about ovarian cancer and how to help raise awareness on KSDK.com.